So thank you for inviting me to speak with you today. And I want to talk with you, see, I did it already without meaning to talk to you a little bit about the work I do and SAGE does in South Los Angeles. We work with a low-income community of color, mostly African American and Latino population, and the organizing and collaborative work we're doing to build power for this community. So just a little bit about South LA, where SAGE is located. It's a densely populated area with over 1 million residents, high levels of poverty, where 65% of residents live below 200% of the federal poverty level. 80% of the housing stock was built before 1978, the year that lead-based paint was banned. And many families double or triple up in housing in order to be able to afford the rent in the area. So 37% of the households are overcrowded. 30% of residents pay more than 50% of their income on rent, which means housing, in order for it to be deemed affordable, needs to be a family paying less than 30% of their income towards rent. So many of them are actually in danger of displacement or being homeless as well. There are 8.5 liquor stores per square mile compared to 0.10 large-scale supermarkets per square mile, which means that access to healthy food is often very restricted. 64% of schools are understaffed, resourced, and without a clean, safe learning environment. 40% of the homicides in Los Angeles County occurred in South LA. Many people, it used to be called South Central. Many people think of South Central, South Los Angeles as not being safe. It's something as if the people who live there are somehow violent or criminal, rather than thinking about a community and families who live there who also want a safe environment for their families. There's only one full-scale emergency room that serves the area, but you have the highest rate of emergency room visits for asthma in the area. And 33% of all reported lead poisoning cases in LA County came from South Los Angeles. So a lot of children getting lead poisoning and suffering from developmental delays. And at the same time that you have all of that, in LA County overall, there are 57 pediatricians for every 100,000 children. And in South Los Angeles, there are 11 pediatricians for every 100,000 children. So it's a very under-resourced community. And that's the community that South Los Angeles works in order to try to overcome these challenges and create a healthier and thriving South LA. So what do? We work on 3 main issue areas, and in all of them, we believe in collaborative work and collaborations in order to build power to make systems change. I'm going to talk to you today, and why I focus so much on housing is our right to housing work. Secure, healthy, and affordable is what we believe everybody has a right to. I'm going to talk to you about our collaborative with Healthy Neighborhoods, Same Neighbors, which focuses on eradicating slum housing in South Los Angeles, and with our Health and Human Rights Collaborative, which really works to frame housing as a health and human rights. It's a human right. We all have the right to housing, to be safe and secure in our homes. We also work on the right to the city, people's control over land. In the northern part of South Los Angeles, near the University of Southern California, there's a big push of gentrification and displacement because of the investment coming in, and we work with a collaborative called that we convene Unidad, United Neighbors in Defense Against Displacement, to organize with the community in order to try to ensure that residents aren't pushed out of the neighborhood, and a national coalition called Right to the City. And then around economic development, the right to jobs with dignity, we convene the Figueroa Corridor Jobs Coalition to place and train residents who often have high barriers to employment and to jobs, and with the Health and Human Rights Collaborative, that the right to a job and employment and a job with dignity is a human right. So a little bit about us. So many people, when they think about poverty in the United States, don't think that people actually live this way in the United States, and they do. The combination of extreme poverty and a shortage of affordable housing forces many families to live in appalling conditions. In these photos, you can see some examples of that. Rotted floorboards with gaping holes where rats come in and mice come in. None of these conditions are because families are dirty, which is often the way that it's portrayed, but landlords run businesses, slumlords, I should say. There's a difference. Slumlords have a way of operating where they prey on low-income communities to be able to operate their buildings in this way, not make repairs, pocket the money, and leave families living in conditions that are appalling, to say the least. So you have rotting floorboards, cockroaches. We're working in a home right now on Adams Boulevard, if anybody is familiar with South Los Angeles, just north of the University of Southern California, where you see many of these conditions, and you have children living with chronic bronchitis, 2-year-olds with asthma, because mold, as you see on the right-hand picture, actually creates asthma in young children, and then you get many chronic skin rashes from the bugs, whether they're bed bugs or other kinds of bites in the home. And this is often, as I said, not because of a family or a family's fault, but it's also a system within the city of Los Angeles that doesn't enforce housing codes, and it has no way of actually, or no real interest in prosecuting or going after slumlords who operate in this way. So collaborative, what is our community collaborative we're operating here with? We have 3 agencies that work together. St. John's Well Child and Family Center is a medical clinic, and they actually have a social medicine department. So when the doctors see a patient and that patient has asthma, they might ask them what their housing conditions are like. If a patient comes in, this is actually the case of an 18-month-old baby who came into their clinic and could not hold up his head at 18 months old. And they had been taken to different clinics, and they couldn't find out what was wrong with him. He had severe lead poisoning. And the doctors in that clinic said, I can't in good conscience treat this child and send him home where he got sick in the first place. And so we formed this collaborative in order to give immediate medical care through St. John's, identify those housing conditions or outside pollutants that are making those children sick, and then working with Esperanza Community Housing Corporation here on the right, who has community health promoters. And those community health promoters look at an immediate to medium-term strategy, working with families to show them how they can actually remediate some of the problems within the home. They do lead testing and low-cost solutions to actually try to make it safer and healthier until SAGE can come in and do an organizing strategy, often a building campaign, or work to put pressure on the city to actually enforce the codes within the home, to make the mandated repairs that they should be doing in the first place. So it's a short-term, medium-term, and longer-term strategy that we've begun to take part in. And SAGE is an organizing, advocacy, and a community engagement organization. We believe that community members, that the tenants are leaders themselves, and that they can impact change within the city to ensure that the city government is doing what it should be doing in protecting tenants in actually the city of Los Angeles. So just some more, through our collaborative, we've been working together for 15 years. We conducted a survey of the tenants of 140, I should say units actually, in South Los Angeles. 45% had mold, 75% had cockroaches, 40% had rats or mice, compared to 7% for renters nationwide. 44% reported lack of running water for episodes lasting more than 6 hours. We've actually been working in some buildings where they haven't had water for months, running water. 47% reported having areas of broken plaster or peeling paint, which is often how children end up picking up the paint, eating it, and getting lead poisoning. And I should say, because of the economic crisis and the foreclosure crisis, we often hear about foreclosures hurting homeowners, but it's actually a big problem for renters as well. Tenant buildings that are being foreclosed upon, landlords walking away from them, and banks refusing to make repairs has really exacerbated this problem within the city. So in that survey that we did, we also found that many of these tenants and families also had chronic disease that was related to their housing. So 49% suffered chronic allergic symptoms, 42% chronic skin rashes, 25% reported asthma, and 1 out of every 7 asthmatics reported wheezing every night in the past 2 weeks, and 15% reported having a family member with lead toxicity. So here's some pictures of some of the work we do. On the left, you'll see this was one of our collaborative's first events that we did. This was for World Asthma Day. We wanted to be able to bring media attention to the fact that asthma was not just some disease that happened to strike people, or that happened to even impact low-income people of color more than anybody else just because it was a random act. It was actually related to housing. And so we were able to really lift up asthma as a disease caused often by either pollutants in the home or around the home. And in low-income communities of color, they tended to be higher toxins in the air in and around the home. On the right, this was an action we just did earlier this year. This was a Fannie Mae-owned property. Part of what we do is also not just highlight the housing and health conditions in the home, but the city's failure to actually protect tenants. In this case, the landlord, the owner of the property, prior to it being foreclosed upon and Fannie Mae coming in, had illegally converted a single-family dwelling into 3 units. So there were 3 families living there. They were without electricity for almost 9 months, and the city did not do anything about it. The hole that I showed you earlier in the floor, they had holes where rats were coming into their home. They put wood over the home, over the hole in order to try to prevent, the mice or rats from getting in the home. We know rats and mice are everywhere, especially in big cities, and you keep them from coming in your home by having a home that is, secure and protected. If you have big holes in your house, they're going to be able to get in. And so this was a case where we were calling on the city of Los Angeles to actually enforce the law and to say, they were saying, well, we have no jurisdiction. It's a single-family home. And we were saying, you have to go in there. This is a life and death crisis for these children who are living with no electricity, broken glass. It was in the winter. On the left here, you see a doctor from St. John's Well Child and Family Center, again, who works as a social medicine doctor working with patients, and then the community health promoters on the right. A big piece of what the doctors do and the community health promoters do is to document the data, to document the health conditions so we can make the case to the media and to the city that something has to change. So along with us taking up our picket signs, we're also making sure that we have partners with us who can actually speak to the issues in a way that it makes it clear that this is a public health crisis and a real issue that the city needs to act upon. Some of the goals of our project included improving the health of tenants living in substandard or slum housing conditions, eliminating those slum conditions in the properties we were in, documenting the medical evidence, as I mentioned, and creating a systematic approach to targeting slumlords who own multiple buildings in downtown and South Los Angeles. The city attorney of the South of Los Angeles was often prosecuting slumlords time and time again, not realizing it was the same slumlord. They hide under these empires where they have different LLCs in which they operate in. So the city attorney would slap the wrist of this landlord without realizing he or she was a multiple offender. And so we were able to, one of our goals was to uncover that for the city and realize that this wasn't mom and pop landlords, that this was a systemic problem with large landlords who owned multiple properties and had this mode of operation. And to improve the alignment, the final goal, to improve alignment and coordination among the Department of Public Health, the city attorney, the Los Angeles Department of Housing was the final goal. I love this picture. In terms of building power and community engagement, Frank McHugh owned over 200 properties that were in slum conditions. 200 properties with 8,000 tenants living in them. And part of what we do around community empowerment and engagement is work with community members to have them think about how they want to confront power. How do they want to confront the person doing this to them? And what they decided to do one Halloween was that their children and them were going to go trick-or-treating in the neighborhood of Frank McHugh and knock on his neighbor's door holding these pictures of their homes and let his neighbors know exactly what kind of businessman Frank McHugh was. And so this is one of the pictures that you see where the children were doing that in Frank McHugh's community. We were able to engage more than 2,500 tenants in at least one aspect of the project, and 250 of them, I would call them, were our core leaders. They either participated in health education and tenant rights sessions. They often filed complaints to government agencies, filed lawsuits with nonprofit legal agencies, often were the testifying in criminal lawsuits, especially against Frank McHugh. They collected documentation for these and participated in these legal efforts. They gave public testimony and planned and engaged in direct action. The direct action, much like you see here in this picture. So what were we able to do as a collaborative? We developed a successful multi-pronged model where we looked at these three areas of a collaborative model, looking at this project and taking it on these different levels, both as a health crisis and a community engagement crisis, and conducted that research that uncovered empires. We reflamed slum housing as a public health issue in South Los Angeles. We raised public awareness of the health and housing connection, improved individual and population health outcomes in the homes that we were working in. We improved legal enforcement. So Frank McHugh was put out of business. He had to sell all of his property that he owned in the city of Los Angeles and can no longer operate as a landlord in the city. We developed a core base of community leaders to engage in advocacy for policy change. We're moving towards that now. And we improved housing conditions and improved the power of tenants to change policy and practices. The next steps of our collaborative work, we really need to highlight and document the code enforcement, the city's failures. So we want to bring media attention, as we did with the Fannie Mae property, about the fact that the city's not doing its job and needs to do its job to protect tenants and low-income residents in South Los Angeles. Mickey Mouse repairs are what the tenants call what landlords will often do. So a pipe bursts, they go in, they fix up that little piece, but the whole piping system may be rotting and they don't fix the entire piping system, so it continues to happen, or the cockroaches continue. One of Frank McHugh's buildings collapsed with tenants inside of it 3 months after it had passed the code enforcement, after they had done an inspection. So that's the kind of, we don't want it to get to that point, but we want to highlight where the city is failing. We've begun a citizen journalism project where tenants are with their phones and with video cameras documenting their house and housing conditions, and we're going to be opening up a website by June if you want to take a look, www.homepage.net, where they will be blogging and posting their videos and photos. And we will be convening a Blue Ribbon Commission in 2013. The original one in 1991 set up the current code enforcement system. We want it to be looked at from top to bottom again, and changes made in order to better protect tenants. And once we do that, we will be launching a campaign to actually implement those policy changes. And then we've begun our health and human rights work to really change the frame as a human rights crisis. Human rights are being violated every day in South Los Angeles. And just these last 2 slides, I know my time's almost up, is about that. So St. John's and Esperanza, who I spoke about earlier, are our partners in this project. SEIU, Service Employees International Union, United Healthcare Workers has joined us on this project, Community Health Councils, Los Angeles Community Action Network, Southside Coalition of Community Health Clinics. We want to build a broad base of support where we're talking about health as a human right and housing as a human right. Thousands of residents have engaged in conferences, in 2 conferences, and they've actually put together a declaration of health and human rights for South Los Angeles, and have begun campaigns around that health and human rights framework. In 2011, we conducted actions after this conference that we did at the convention center at a site where they had demolished the orthopedic hospital, part of the orthopedic hospital in South Los Angeles, to build luxury housing, and were able to, through community pressure, ensure that a community health clinic that was going to serve 20,000 low-income uninsured patients was actually going to be built in its place. And you can find this on our website, but this is a picture of the Declaration of Health and Human Rights. And some of those rights that are being presented that the residents and stakeholders of South Los Angeles came up with include the right to health. That includes the right to comprehensive and preventative health care, culturally competent health care, the right to translation when you see a doctor, both for when you're talking to your doctor, but have documents translated, the right to behavioral health, especially culturally competent behavioral health services, the right to education and employment from preschool to college, high quality education, the right to housing in a safe environment, much about what we've talked about here today, the need for affordable housing and healthy housing especially, the right to food and food sovereignty. 0.11 food, supermarkets or large-scale supermarkets in a neighborhood is not okay with 1 million residents. How do we actually create more food options and combat food deserts, but also have, community gardens and other ways that people can have ownership over the food that they're using, and then making sure that it's healthy, pesticide-free, and that they own it and they can actually also sell it in markets. And the right to dignity and safety, anti-criminalization measures. In an area like South Los Angeles, I started by saying it's often seen as a violent place where the people are at fault and the people are violent, and that's the way they're treated by the police, and that's not who they are. And anybody who's black or brown, especially, well, in Los Angeles and everywhere else, it's not confined to Los Angeles, but it's something that they've really felt like it's a way to criminalize people and lock people up in prisons, when really we should be providing education and employment. So I'll stop there, and thank you very much.